Hi, as you may have already been informed by your medical provider, I want to walk you through the details of provider order for life sustaining treatment, or POLST, at this time. You may also refer to this video as often as you need, so you may stay well informed of exactly what you're authorizing when it comes to filling out the POLST. Let's get started. The main purpose of the POLST is to spell out and specify what treatments you would like performed on your behalf in the event that you become incapacitated for any reason. Unlike the advance directive that can and should be filled out by anyone over the age of 18, the POLST document is mainly for use in the healthcare provider's office and for their reference. There are different POLST forms for each state. So we would recommend that you look up a form for your specific state if outside of the state of Utah. Again, you will not be filling this out on your own, but you can look at the form to get comfortable with what your healthcare provider is asking you to decide. Also, unlike an advance directive, a POLST form is filled out with a provider at specific decision points in a person's healthcare. As was referred to earlier, a POLST form is only filled out at specific points in an illness. These points include an individual who has received a new diagnosis of life-limiting illness, or an individual who is experiencing an exacerbation or worsening conditions of a chronic or new life-limiting illness. A major reason these topics are being discussed with you by your healthcare provider is because your healthcare team wants to make sure that they are treating you in ways that are consistent with your goals of care. Goals of care are simply what your priorities are for treatment. This might include curing a disease, living a long life even if attached to machines, or focusing on comfort. Every individual's goals of care will be different based on their preferences and priorities for their life. Remember that this is for you to communicate what is most important to you. Make sure you feel comfortable with your decisions and not pressured by anyone. We will review the different life-saving or prolonging measures that are found in the POLST form. Endotracheal intubation is when a tube is placed into a person's windpipe through the nose or mouth. In most cases, this is done in emergency situations when a person is unable to breathe. It is also used during some surgeries. In most cases, a person will be sedated before intubation to decrease comfort of the tube being placed. Muscle relaxers are also usually given to help your body to relax. The benefits of intubation include allowing oxygen to reach the lungs, keeping the airway free and clear, as well as protect the airway and prevent choking or breathing in fluids. The potential burdens of intubation include infection, possible bleeding in mouth and windpipe, possible throat soreness afterwards, injury to mouth and teeth, possible injury to voice box, windpipe, esophagus, or thyroid gland, as well as possible inhalation of stomach contents and acid. There's also a risk of a puncture or tear in the chest cavity, which could lead to a collapsed lung. Mechanical ventilation is when a person is assisted in their breathing by a machine known as a mechanical ventilator. The ventilator sends air, which may also have increased levels of oxygen, to the person's lungs through tubes. These tubes pass through a humidifier device, which makes the air more comfortable to breathe by warming and moisturizing it. A ventilator is used for people who are incapable of or have difficulty breathing on their own. The ventilator is used until the person is able to breathe on their own again. People who are using a mechanical ventilator are often sedated and may be unconscious or conscious while using the ventilator. Mechanical ventilation carries certain risks, which may include increased chances of lung infection, such as pneumonia and possible damage to the lungs. Although it isn't critical for emergency care, it is very helpful for healthcare providers to know a patient's wishes about feeding tubes, or also called assisted nutrition. Some feeding tubes require a surgery to place them in the stomach or small intestine if you are going to be on a feeding tube for longer than 2 weeks. A trial period of artificial nutrition may include, but not be limited to, placing a nasal or oral feeding tube that either ends in the stomach, duodenum, or jejunum. The benefits of this intervention is that it may help keep the patient's nourishment and sustain life for a longer period of time. Potential burdens that may come with artificial nutrition include getting fluid in the lungs, stomach pain or upset, general discomfort, and even in dementia patients requiring restraints to be needed to prevent them from pulling out the feeding tube. Cardioversion is a medical procedure that restores a normal heart rhythm with certain types of abnormal heartbeats or arrhythmias by sending electric shocks to your heart. The benefits include taking less time than converting a heart rhythm with medications. It can be more effective than medication in an emergency setting when an individual is unstable or has a cardiac arrest. Some of the burdens include if a patient has a blood clot in their heart, it can become dislodged and cause a stroke. Patients can develop heart rhythm problems during or after the procedure, although this is rare. Skin burns from the electrical shock where the electrodes are placed on the chest. The use of vasopressors may also be indicated. These are intravenous or IV drugs that raise the blood pressure by making the blood vessels contract. The benefits of vasopressors support vital organs with oxygen. They prevent organ injury and prevent shock when tissues are deprived of oxygen. It can increase the heart's ability to contract and pump blood to the body. Some of the burdens include that they may cause a rapid heart rate with certain vasopressor medications. It may also cause oxygen deprivation in the non-vital organs like the gastrointestinal system and the hands and feet. It may cause abnormal heartbeats, and it may also require a central venous line or arterial line to monitor the individual closely. This also may increase the risk of infection. One of the main interventions that require specific directions in the POLST is, of course, cardiopulmonary resuscitation. It is used in an emergency if an individual's heart stops beating adequately through performing chest compressions and breathing assistance. CPR can save an individual's life and may return a young, healthy individual to the same health they were in before their heart stopped, and then it can improve chances of survival. However, the burdens include that there is no guarantee the heart will restart, especially in unhealthy individuals. There is a high chance of having cracked ribs and a very sore chest, possibly even a collapsed lung from a rib puncturing the lung. There can also be some serious health problems after surviving CPR, all depending on how the body responded to CPR and how quickly CPR was initiated after cardiac arrest. It may require ICU or be dependent on others to function afterwards. If you feel that life-saving measures will be too burdensome, you may select the comfort measures option in the POLST. Comfort measures is a medical intervention treatment option which focuses on maximizing comfort and dignity. Medical care may include oral and body hygiene, reasonable efforts to offer food and fluids orally, medication, oxygen, positioning, warmth, and other measures to relieve pain and suffering. This option permits transfer to a hospital only if comfort measures can no longer be managed at the current setting. Here are some additional resources you may refer to for more information. Remember, you can always change the conditions interventions in the POLST at any time with your provider. We encourage you to refer to the QR code often to get well acquainted with the POLST. Thank you for your time.